So if your gut is also not healthy, if your liver is not healthy, everything has an connection to the brain as well.
So one often hears that there is no cure for Alzheimer's. Is that true?
Till now we are in the experimental models,
Okay.
and there is a absolute cure is not there till now. 2 years old children, they are constantly seeing scrolling the mobile. Gadgets are affecting our neuronal setup.
What are the lifestyle changes that we can keep in mind?
So there are three words: hurry, worry, and curry. There are majority of the tumors which can be treated and can be cured as well. The complete removal of the tumor is possible. Every 3 minutes there is a stroke.
Really?
Yes, and out of that, 40 to 50% people are dying because they are not reaching in the time to the hospital.
Welcome to the latest episode of my weekly podcast Straight Up with Shree. প্রতি সপ্তাহে আপনারা জানেন আমরা এমন কিছু কনভারসেশনস আপনাদের সামনে তুলে ধরি which are sometimes inspiring, sometimes important, sometimes inspirational. আজকে আমার ফ্রন্ট কাউচে এমন একজন মানুষ আছেন যিনি যখন সেটে এলেন I was really shocked because today's episode is a very different one. If I can use a very cliched term, zara hatke. I am sitting opposite one of the city's leading neuro and spinal surgery specialists, one of the leading pioneers in the field, Dr. H.C. Gupta, who belongs to HP Ghosh Hospital. Sir, welcome. A
Thank
very
you.
warm welcome to you. When I saw him after reading his vast credentials, I expected, as I said in jest to you earlier, a much older man.
Yeah.
Because, our impression of a neurosurgeon or somebody who's dealing with trauma of the spine, brain
Yeah.
tumors, as you said, the field of neurosurgery
Very
is
vast.
absolutely, it's vast and diverse. I thought, ekta shada paka chul with his baritone voice, we had spoken on the phone, but this was a pleasant surprise. Do you often get that reaction? We are starting on a lighter
Yeah,
vein.
I often get reaction from everyone, but somehow I maintained this thing
Right.
because I should look fitter,
Absolutely,
and
absolutely.
this gives you an confidence to
Ekdom,
deal with
ekdom.
internally as well.
Right, right, right.
So
Not just
that is a-
confidence, I think, doctor, it brings a smile on our faces. আর আমরা যখনই এনিথিং টু ডিল উইথ দ্য স্পাইন, নিউরোসার্জারি, ট্রমা, এইগুলো শুনলেই we think of the worst,
yeah,
right?
right.
But when we see somebody like you with a cheerful demeanor, somebody who's fit and handsome, I like my doctors to be good looking. And I think from his vast knowledge, you will realize that his physical demeanor is matched by his, absolutely brilliant mind. Welcome to the show, sir. How do you feel being on Straight Up with
Thank you
Shree?
so much. I am feeling very good, and it's a privilege to be here.
Thank you, sir.
And it is a platform I would like to
Yes,
share my thoughts
absolutely.
and experiences and so many
Right,
things
right.
which may benefit our people.
Absolutely. That is the idea of this particular episode. আমরা আজকে অনেক কিছু এমন কথা বলবো যেটা আমাদের মনে হয়তো অনেক দ্বন্দ্ব আছে, অনেক জিজ্ঞাসা আছে, কিন্তু আমরা ক্লিয়ারলি কোনো দিন, আনলেস আমাদের বাড়িতে এটা হয়েছে বা ইমিডিয়েট ফ্যামিলিতে হয়েছে, আমরা খালি ডক্টর গুগলের কাছে যাই, which is a terrible thing to do, but we are all guilty of the same. Firstly, sir, tell me a bit about yourself. You're not from Kolkata, you're from Ayodhya,
Yeah,
and you've made Kolkata your home since 2012.
yeah.
So you're a Kolkatan now, like us. Amio Probashi, I came after 2 decades
Okay.
outside, back to my hometown. So tell us a little bit about your journey before we get into the medical part of it.
I was born and brought up in Ayodhya. That at that time it was an average town,
Right,
not like today.
right,
Today's scenario is very changed.
absolutely.
It's there is an airport and so many things.
Yes.
Big medical college and other
Right,
things are
right,
there.
right.
So it was not there at that time, and I started my journey and I went to graduate and postgraduate in the medical field. I did my MBBS and Master of Surgery from the King George Medical University.
Right,
It is a very old, 105 years old
right,
university,
right.
and that is an autonomous university of the medical sciences, which we rarely see in our country. So that is a prestigious institute. I completed my Masters of Surgery, and during my study, I got an interest in the neurosurgery because I saw so many people were being treated for the critical stages like trauma, head trauma, and
Yeah.
they were struggling for their life.
Yeah.
And when they get discharged, it gave me something that I should be doing that.
Yes. Yes.
So it was difficult, but I tried and I appeared into the entrance examination that was all India. And I did my super specialization from the IPGMER Kolkata.
Kolkata.
So I got an opportunity. I was selected in BHU as well, but I chose this because I heard that I can get an vast exposure here.
Yes. Yes.
Surgical exposure.
Right.
So
Right.
that
right.
was right. And right after completing that, I started my journey into the medical college. I was a trainer, I was professor, and I was dealing with the training of the neurosurgeons as well.
Right.
And then I started sub-specializing. Like I did my sub-specialization in the minimal invasive neurosurgery.
Right.
That is endoscopy.
Right.
So that is a modern
Technique.
art. Yeah,
it's an
you can
art.
say.
Absolutely.
And I went abroad and learned few things more, and then I came back. So now I am serving here, and I am trying to give my all the experience
Right.
and to keep up my learning as well.
Right. Well, firstly, I would say, it's a privilege, sir, to have you practice in Kolkata. আমাদের শহর ছেড়ে তো অনেকে চলে যান. It is wonderful to come to a city which may not be as well known as other cities, but hopefully, hospitals like HP Ghosh are, changing the game, changing the perception, and we can get the best treatment in our city. God forbid these situations arise. স্যার, আমি প্রথমেই আপনার কাছে একটা একটু লেম্যানের মতন প্রশ্ন করব. A friend of mine in Bangalore, who was in her mid-40s, suffered a stroke. And when I read her update on Facebook, after a few days, she had put up an update and she explained that usually when one hears of a stroke patient, one automatically again presumes that a person of a certain age only can have a stroke.
Yeah.
And I was really shocked. She, of course, mentioned that probably she had been a chain smoker. Of course, the stress of her high-profile corporate job, and also, probably small niggling signs, of high BP, feeling dizzy, which she had been neglecting, which we think, oh, it's just one bad day. Chalo, pop in a pill. We are all pill poppers. So I'm going to start with the stroke, which I think we need more awareness about. What are the telltale signs? How can I lead a more healthy life, take care of my high blood pressure so that I don't have to, suffer like she did?
Yeah. So as you said, she was 40.
Yeah.
She is 40.
Yeah,
I mean.
in her 40s, yes.
Yeah. So earlier it was happening to the older people,
Right.
more than 60 years
Yeah,
of age.
yeah.
But right now, paradigm has shifted towards the younger age.
Okay.
And it is not only in the like 40s, it is happening below 30 years as well.
Ore baba.
That is like 28, 24.
24.
Sometimes we see.
Oh God.
Even I have operated on 16 patients of the brain hemorrhage between the age group of the 24 to 39.
Oh God.
Though the results are better, but it is happening.
It is happening, exactly.
So it is not an elderly's problem right now
only,
anymore.
Right, sir.
We are dealing with an epidemic like situation. It will be growing. And what are the causes? Because as you said, she was a smoker and everything.
Yeah.
So lifestyle is very important. Because the stroke, when we are going to discuss the stroke is in certain situation where we get some sort of abnormal changes in our body, state of the body, or mind, or anything.
Yeah.
Like we feel sometimes dizziness, or sometimes we have numbness in our hand, left or right, anything. Or we feel
tingling.
Yeah, tingling. We feel any deviation or some sensations on our left or right side of the face.
Right.
So you can talk about the we deal it as in fast, FAST,
Okay.
face, arm, speech, and time.
Right.
So these are the things we can evaluate at our home as well.
Okay.
Something is happening very fast, sudden
Mm,
onset.
mm.
Time means sudden onset. There is a value of the time. If there's something, a change is happening at very fast speed or sudden onset, like suddenly I am feeling my left hand or right hand is getting
Ah,
weak,
ah.
or my mouth is deviating towards side, or
Mm-hmm.
my speech is slurring. I cannot
Slurring.
speak.
Correct.
So these are the signs and symptoms of the
Okay.
stroke, which
Right.
we can recognize at home by anyone.
Okay.
These are the signs and symptoms.
Okay.
Or maybe sometimes there may be unconsciousness for a brief time, like 1 or 2 seconds. That is called as transient ischemic stroke, TIA, transient ischemic, or long unconsciousness, coma like situation in the cases where we have massive brain hemorrhage. So there is a spectrum from the lighter symptoms up to the critical stage. If we recognize it at home, the signs and symptoms, we can find out that there is an door to needle time when we see the onset and when we admit the patient.
Right.
That is very critical time.
Right, right. That golden hour, as
Yeah,
they
yeah.
say. Absolutely.
3 to 6 hours.
Right.
Maybe 3 hours is the best. But even if we get more 1.5 hours, like 4.5 hours,
Right, right, right.
from the symptom onset and till the treatment or admission, there is an good result. We
Okay.
can reverse the neuro deficit. Neuro deficit, for the people, I am saying that neuro deficit. Deficit is something is lacking. So I have full power in my hand right now, and I suddenly I feel that there is a lesser power. That means something has been deducted, deficit. So if we recognize that deficit is there and timely admission is done and timely treatment is done, we can reverse it. If it does not happen, it may remain permanently. That may lead to the permanent disability for the rest of the life.
Acha.
Suppose that I am a worker and I am earning from my right hand,
Right.
and my right hand goes for the
Yeah,
permanent
yeah,
disability.
yeah.
It will change the whole scenario.
Absolutely.
Not only for the me, by my family, people
Everybody.
who are
Dependent
Yeah,
on
yeah, yeah.
one. Yeah, yeah.
So nowadays, what is happening due to the lifestyle changes, smoking, blood pressure, and sometimes genetic as well. My mother and father suppose that they are diabetic or hypertensive, then I will carry it.
Correct.
And there is a predisposition when we are doing a long hour works.
Stress.
Stress is a very
Killer.
important factor.
It's a killer. Yeah.
So that is why it is happening in the younger people as well. And it is also related to the cardiovascular disorders.
Okay.
The person who are having risk of the hypertension and they are having some cardiac disease, they are also at the increased risk for developing a stroke.
Okay. Okay.
Because sometimes there is a clot happens in the heart and that flows through the vessel and lodges in your brain.
Yeah.
That also causes a
Yes.
stroke. That is called as cardioembolic stroke.
Okay.
So both are interrelated.
Right.
If you have cardiovascular disease,
You
then
can
you are
be
going
prone
to
to a
have more
stroke.
risky
More prone. Yeah.
to have cerebrovascular disease,
Right.
CVAs.
Right. Right.
So that is the thing. And we can modify it. There are two types of factors, modifiable factors and non-modifiable factors. So when something has already happened, like you said that she suffered like that thing.
Right.
So that happened. Whether she was diagnosed with the stroke or not, I don't know. But that episode happened. So we need to prevent it.
Right.
First thing is prevention, then the early treatment, and then the rehabilitation. The people who have already deficit and all, they can be treated in the setup, a good setup, and after that they can recover in the rehabilitatory condition.
Facility.
Yeah,
Yeah. Okay.
So this is the phases.
Right. আপনি এটা খুব বড় কথা বললেন. You mentioned the word lifestyle. I think so many of our diseases are rooted in poor lifestyle choices.
Yeah, of course.
And of course, the pressure, the anxiety, the stress of our working lives, the work-life balance, which I think in India is very poor. You know, I have seen my colleagues who are in corporate jobs ever since the COVID, everything is online now. It's a hybrid work model. But you know, there is no sense of boundary. The boss, the senior is calling at all odd hours. people are unprofessional. You write an email, to them at 9 in the morning at the start of the workday. You get the reply at 12. So suddenly, from sleeping, your mind is still
There is
working
a
that,
stress. Yeah.
yes, like I have to get up, my boss's email has come. And I think, of course, corporate life is highly paying, and, self-employed people like us, our struggle is much higher. But at least there's peace of mind to a certain extent. I don't go to sleep thinking, oh my God, tomorrow what's going to happen? Kya hoga? Presentation mein kaun pakda jayega? All of that. Now, if you can just tell us, because I know a lot of people are listening who are also youngsters, right? If you can tell us about what are the lifestyle changes given in mind ki yehi duniya hai. It will not change because disease is happening, right? We've had
Yeah,
the
yeah.
COVID and people are still, as unmindful. What are the lifestyle changes that we can keep in mind, perhaps for trying to prevent such a condition?
Yeah, because stroke is predisposed by, and it is precipitated by so many factors,
Right.
and there are some pathological factors as well.
Yeah.
So there are three words: hurry, worry, and curry.
Mm.
These are three things. As you said, boss ने phone किया, अभी तुरंत उठना है क्या?
Ha, that,
So this should
urgency
not be.
culture.
That is
Yeah.
an hurry. I have to go to office right
Right
now.
now.
If I
Yeah.
don't reach in time, then I will be facing something.
Right.
So this is, you are hurrying for
Yeah.
everything,
Correct.
every time. Worry means you are already stressed,
Anxiety.
thinking for everything, and you are eating mirch masala बहुत खा रहे हैं, spicy food, and you are having
Fats.
oily and all.
Oily.
So you have to take care of your diet and your physique and your mindset. There are three things. Diet means you have to organize your diet schedule. What healthy things you have to include in your meals.
Right. Right.
You have to make your work schedule so that you cannot be stressed to that extent. You have to tell that, yeah, this is my working time. In corporate setup, people are working beyond their working.
Absolutely.
That
There
is the
is
main
no
reason.
work-life balance. Yeah.
To reduce stress, they smoke sometimes.
Absolutely.
And they don't know this is a vicious cycle. You are thinking that you are smoking to reduce the stress.
Ulta
And
ho raha hai.
smoking is again causing that thing. And it
Correct.
is, so it never ends.
Catch
It's never ending
22.
cycle.
Yeah.
And it is increasing your cholesterol, your
Right.
triglycerides,
Right.
your blood vessels are facing an insult, and it is growing. So we need to exercise every day. And previously it was a myth that as we grow old, then only we should exercise. It should not be there. Like in Western countries, we have to start exercising and taking care of our health from the very beginning. Like in your 20s,
Right.
they
Right.
do it.
Right.
They run every
Absolutely.
day and all.
Absolutely.
We don't have this culture.
Yeah,
You
yeah,
can
yeah,
see around yourself,
Right.
in your close vicinity,
Yeah, yeah,
how
yeah.
many people you are seeing when you wake up at 6 a.m. How many people you can see older people only,
Older
who
people
are
only.
walking only.
Correct. Correct.
You
correct.
cannot see the youngsters and all, they are running.
Absolutely.
It's 2 to 3%
Yeah,
maybe.
yeah, yeah. Very
And that
true.
is in Kolkata, because
Yeah.
in metropolitan.
Yeah.
In periphery and other places, you cannot see this thing.
Yeah, yeah, yeah.
So there must be an awareness about this thing.
Right.
Nobody is knowing that it can be prevented. There is no awareness program like this. It should be initiated by the healthcare professional who are dedicating their lives to the neurosurgery and neuro like situations, and NGOs and others. There should be a common effort to
Correct.
tell that we can prevent this thing. We can reduce this thing. At least the incidence of the people admitting with the stroke in the hospitals will be reduced.
Correct.
Every 3 minutes there is a stroke.
Really?
Yes. And out of that, 40 to 50% people are dying because they are not reaching in the time to the hospital. From the very beginning, from the extremes of ages, like from the younger to the older generation, we must exercise daily.
Right.
At least 10 to 50 minutes. 15 minutes. If somebody is smoking also, they should also do the exercise. That will reduce their comorbidity and the predisposition to the stroke.
Yeah.
They should take care of the diet also. Likewise.
Correct.
And mindset is of course necessary.
Of course.
You have to meditate and other things. There are so many things coming. We don't go into that detail.
Right.
But we can make an work schedule.
Right. Right. I think these are
So
important
there
points.
a help is needed always. People don't know. because everyone is not belonging to the medical fraternity.
Right.
So they must be educated about these things.
Right, right.
They will do that.
Right. I think strokes are becoming increasingly common. In fact, when I was growing up, sir, I didn't hear of so many women having strokes.
Yeah.
You know, because I run a community of single women, and I was telling you we have women of all age groups. I'm hearing a lot of women now, having high blood pressure, cardiac problem. In fact, silent heart attacks are so common in women, especially after menopause, because, our hormones completely, go through a radical shift, if I may say
Yeah.
so.
That is an predisposition after 45 years or 50.
Hmm.
But as an interesting story, I'm going to tell you.
Yeah.
I have recently operated on a 33-year-old female
Okay.
in the HP Ghosh only.
Right.
She presented to me in the outdoor with the sudden onset of weakness of the right side.
Oh.
And when we did CT, it was elsewhere in South 24 Pargana. I was seeing some patients,
Hmm.
and at some center, it was diagnosed a large brain hemorrhage. So I immediately advised her to shift here.
Hmm.
She got operated. Now she is being discharged as well.
Okay, she's
She's
fine.
fine.
Touch wood.
So that is the 33 years old female we are talking about. Even before the menopausal,
Correct.
before the
that
shifting
age.
of the hormonal
Yes.
that thing.
Yes.
So there are so many things. Women are more predisposed to the vascular disorders, vasculitis, vessel related. They are having more aneurysms, cerebral aneurysms. A balloon aneurysm is an ballooning of the normal blood vessel, or sometimes artery and veins. They entangle. That is creating a mass that is called as arteriovenous malformation, and that bleeds.
Right.
So these are the things. She's having normal blood pressure. She is having large brain hemorrhage. How will you explain?
Exactly.
We-
How did that happen?
Yeah, so we did an CT angiogram.
Yeah.
We find something and nidus. We call in medical terms a nidus, arteriovenous malformation that bled. So we did the surgery. It was removed, and she is doing fine.
Right.
So even if you are not having hypertension, you are not in the menopausal or
Still it can
postmenopausal,
happen.
it can happen.
Right.
Due to the more precipitating regions for the vasculitis in the female.
Right.
So females are more suffering in the non-hypertensive age group.
Right. Interesting. আর একটা কথা ইংরেজিতে একটা প্রবাদ আছে, প্রিভেনশন ইজ বেটার দ্যান কিওর। সো আমার মনে হয় দি অ্যাওয়ারনেস অ্যাবাউট স্ট্রোকস, whatever little we could gather in this episode, apnara, you can always go on to the HP Ghosh website, get more information. You have a great doctor there who you have seen on the show, and you can always reach out to him for any niggling sign which you feel you may have noticed in yourself or your loved ones.
I would like to add something in the management of the strokes. That is a recent shift in the management. Previously, we were using a large craniotomy. We used to open the skull and remove. Now we are using minimal invasive approaches.
Okay.
Even within a very small hole or everything, a very smaller cut in the skull, we can remove the large clot.
Okay.
Using the neuro navigation, microscope, neuro microscope. These things are available at HP Ghosh. Everything is available. Apart from that, we are doing endovascular treatment.
Okay.
That is, I will not go and cut your this thing.
Head out. Yeah.
We will do a reach through an artery, and it will be treated through the arterial system only, with a very smaller prick only.
Okay.
That is called as endovascular management of the stroke. It is the most modern treatment of the CVAs, cerebrovascular accidents. So we have to diagnose, and the same sitting we can treat as well. Yeah.
Right.
Suppose that a cerebral aneurysm has bled, we can treat it without opening the skull.
Okay.
That is called as coiling of the aneurysm. We can go through this groin region, and through the artery we reach to the brain, and stop that bleeding.
Stop the bleeding. Okay.
And remove the cause as well.
Right.
That cures permanently.
Okay.
The advantages are we can discharge the patient in 1 or 2 days.
Wow.
Otherwise,
that's breakthrough.
They stay for the months and months.
Exactly.
So for that, a great skill is necessary, and I have learned this through a time period.
Right.
So The people must be knowing. You should not be afraid of, scared of
Yeah.
anything.
You know, I'm going to
There are
ask
better
you.
treatments.
I'm going to ask you a question, probably একটু devil's advocate play করছি. You know, whenever আমরা এই brain surgery কথাটা শুনি, you know, when we hear the term brain surgery or neuro medicine, we feel very scared. One is we think patient বাঁচবে না. This is the end of the road. Second, the expense. I mean, I've recently lost my mother last year, and you know, she was in ICU for over 2 months at a leading private hospital, and we bled as a family. It was a bloodbath financially. She was a stage 5 renal failure patient, and of course, there were, you know, surrounding complications. Coming to, you know, a brain surgery as cutting edge as you just mentioned right now, sir, what about the expenses? Are there schemes which HP Ghosh, if you know,
Yeah.
has, or the government is doing something, you know, to reduce the financial burden? I mean, the treatments you mentioned, can somebody who is in a mufassal or a village person, can they afford this treatment?
Yeah. In West Bengal, we are having Swasthya Sati scheme
Yeah,
that is launched by the state government,
right.
and it covers up to 5 lakhs for an year. Though packages are divided, suppose that a patient has suffered brain hemorrhage, we can treat with the Swasthya Sati scheme as well.
Okay, okay.
And if the patient is stable, they don't need to expend a penny apart from that package. We can
Okay.
discharge. Suppose that package is smaller, then only we need some extra
Support.
expense. Otherwise, in the majority of the cases, if the patient is stable, we can treat them with the Swasthya Sati scheme only, which is
Right.
usually available in the HP Ghosh. We can
Right.
treat them.
Right. Okay. Important points. Affordable healthcare. I once gave a talk on female health where I said that affordable healthcare is the crying need of the hour. Elections are up next year. We hope our government at least will expand this scheme to make healthcare accessible. You know, whether when you want to go to a doctor with this kind of experience at a good hospital, it should be within your reach. আপনার নাগালে হওয়া উচিত এই treatment. As a family who's lost a mother, who had to, you know, sell an asset, a physical asset, to pay for her treatment, I have gone through this.
Yeah, I understand.
And you know, I felt when I was there in the ICU that there is no difference between somebody like me and somebody who brought their loved one, you know, in a train, you know, কষ্ট করে. At the end of the day, we were both struggling. We were both
Right.
gasping for air. Now, moving on from strokes, sir, you know, we were talking about degenerative brain disorders. And, you know, ekhan theke, if you can guide us through, you know, an ailment which one hears more and more of these days, especially if you're a caregiver to aging parents or one parent, Alzheimer's. And often the onset of Alzheimer's is sort of, it happens, and then one hears another very scary term, dementia. And I know this from a caregiver's perspective, that caring for a person with Alzheimer's and dementia is so hard, it's so arduous, it's financially exhausting, but it's also physically laborious, because the
Right.
person is losing their memory and, you know, their sense of surroundings. But also, recently I was watching a talk. I am fascinated by the world of medicine. And there they were saying that, like stroke, Alzheimer's is now also happening to younger people.
Yeah.
You know, it's not like only if you're 80 you can get Alzheimer's. You know, it's happening to people very young. And one of the reasons for that is our digital dependence.
Yeah.
And our brain constantly being on fire, because, you know, we are always swiping, scrolling, you know,
Yeah.
that's become our life. So if you can take us on this path.
Yeah, Alzheimer's is an earlier it was considered elderly disease,
Yes.
but now there is a shift.
Okay.
Though that is not significant as strokes, but it is happening.
हो रहा है,
Yeah,
हाँ.
yeah. So that is called as an early onset Alzheimer's, early onset. So it is happening at is at the 45, 50 sometimes. So how will you diagnose that? We are dealing that we are having some difficulty in our routine
Right.
work.
Okay.
When you first experience the symptoms, like you said, memory loss,
What are the symptoms?
you are forgetting the things of your routine. Usually you are going to toilet and you are going to find your toothbrush, Suppose that.
Okay.
There are so many things there, wash basin, at wash basin, you are not picking the toothbrush. Though it is there, you
But
can
you
see
are
that.
struggling.
You are picking
Yeah.
something else.
Right, right,
You
right.
are thinking all the time something else, and brain is going into the early degenerative change. So there is an age for the degeneration that is called as more than 60.
Right.
Then your brain starts shrinking structurally. The
Okay.
volume of the brain shrinks.
Okay.
And likewise, the blood flow to the brain, all the vessels who are carrying the blood to the adequate amount, it is altered. So that is happening in the early age group now.
Right.
It is changing the structure of the brain, the neurons, the connections, everything is changing. You cannot correlate. You can see the things. So you cannot pick a toothbrush. Now you are going to the office. You cannot find your things. You will not share with anyone because at this young age, you cannot share.
Yeah.
If you share, then you will be thinking of some social stigma.
Yeah, and also people laugh at you. Arey, memory loss ho gaya, something.
Maybe.
They'll just brush it off.
Yeah, that is happening because we usually do not talk about these things in
Right.
our population.
Correct.
We have a trait to ignore the things.
Right. Right.
So at this age, if we are feeling something unusual, which usually happens at the 60 or 70, we think that it is going on. Let us leave
Chalne
it.
do,
We should not be sharing with anyone.
Correct,
They
correct.
will be thinking that we are growing old very fast.
Yeah,
also.
yeah. And aging is a taboo in our society.
Yeah.
Yeah.
So sometimes what happens, it is pathological. The degenerative changes of the brain happen very fast.
Okay.
And there is an predisposition from various factors like stress and all. There is a trait, early onset of the Alzheimer's. In those patients, there is a trait. They are being genetically predisposed as well.
Right.
Maybe.
Is it
We
hereditary?
don't find history because sometimes people die without being diagnosed. Suppose that a person of 45 years, he is suffering from the early onset and their parents are not there.
How will you know?
You will not know. Maybe he is carrying the genes and other things. So the diagnosis is very important. Earlier there were no diagnosis. People used to die without being diagnosed.
Correct.
Whether
correct.
they were diabetic, they were hypertensive. We just heard the news. He died or she died.
Yeah.
So there is we need to screen the people. So we must start screening from the 18 years of age.
That young?
Yeah.
Okay.
We have to screen a lot of things. It is a blood profile, it is a genetic profile, and so many things. If we are doing screening from that age, we can prevent such thing to happen at an early age. Otherwise, in elderly cases, it will be progressing. Alzheimer's. And usually the whole system is involved. Their routine is very bad, and they usually need an help, professional help.
Yeah. Yeah.
So we are prescribing some medications for the halt of the progression, a slow pace of progression, but eventually it will degenerate. So the only thing we can do is to provide occupational professional care in the patients in which it has already happened, and we have to screen and stop happening it in the earlier age group.
Okay.
That is the thing.
So one often hears that there is no cure for Alzheimer's. Is that true?
Till now we are in the experimental models.
Okay.
And there is a absolute cure is not there till now, as compared to the Parkinson's, which is one of the other degenerative disorders of the brain. We do have an cure for the Parkinson's.
We
Recently,
have it now?
we have
Wow.
gone through a breakthrough.
Okay.
And there is a part in the brain which initiates the Parkinson's symptoms.
Okay.
So that is substantia nigra and pallidus. So we can abolish that part which is diseased, and we can get symptom free completely.
Wow.
The absolute cure for the Parkinson's.
This is amazing.
Yeah. So earlier we were used to give medications only for the long time. There was no cure.
Yeah.
Sometimes symptoms were aggravating, sometimes slowing down. But we have to select the candidates. Who are the candidates for the Parkinson's? who needs surgical ablation and they will be cured. We have
Right.
to filter through so many criteria,
Okay. Okay.
but we do have cure, surgical cure there.
Right, right. And why is it that, Alzheimer's and dementia seem to be so synonymous with each other? মানে Alzheimer's হলেই আমরা dementia কথাটা শুনি। এটা কি, is there also somewhere, is it hereditary? Is it your lifestyle? Is it, again, poor lifestyle choices? Are we too much dependent on our phone, our screen? Is our mind, are we really not taking care of our mind?
Yeah, obviously, we in the present era, we are not taking care of
Right.
our
I
minds.
think so, yeah.
We are not healing our mind as well. Repeated injury to the brain,
Correct.
repeated mental insults,
Right.
repeated stress, and we are not taking care of that. So it is precipitating. It's keep piling up. A lot of stress is there. So that is the common pathway is the early degeneration of the brain. The brain which earlier used to degenerate at older age, now
It's
the same
happening
process
now.
is happening earlier. Whether you talk about the stroke, Alzheimer's or Parkinson's, early onset Parkinson's as well, the common pathway is the early degenerative changes of the different parts of the brain and which are happening because of the our lifestyle, some genetic predisposition and not screening the patients, people at earlier age. We can prevent this thing.
Okay.
So what happens in the Alzheimer's, the memory loss or memory impairment is the predominant factor along with the other neuronal disturbances. Alzheimer's patient will not be only having feeling that memory loss only is there. There will be difficulty in doing other works as well.
Okay.
Execution from the hand, walking and so many things. The entire neuronal system will be
Collapsing,
changed.
yeah.
Yeah. On the contrary, the Parkinson's, they have lesser component of the memory impairment. They will be feeling like continuous nodding of the head.
Yeah.
You can observe.
Yeah.
Or their hands will be
Shaking.
feeling pill rolling. You have pill rolling tremors like this.
Okay.
This. You can observe at home. This I am telling that if someone is observing some other person that they are having these symptoms, they can diagnose it at home and reach for the care at an early age.
Yeah.
So these are the symptoms which need to be educated and told. And Parkinson's have difficulty in writing. They are not able to sign. Their gait is different. They cannot walk properly.
They cannot walk, yeah.
Very slow steps. So both are the degenerative disorders, but the basic difference is that Alzheimer's have no cure till now. It's progressive.
Very sad. Yeah.
And it needs an occupational and professional care. Apart from that, it is progressive. It will be progressing with other components like memory loss plus others. And in Parkinsonism, we do have a cure, and we have less memory loss, and we can easily diagnose at home clinically. The symptoms of the Parkinson's are much more obvious as compared to the Alzheimer's. So it is we can treat it in more efficient way. So that is the thing.
Right. So, as you're speaking, আমার মাথায় একটা প্রশ্ন ঘুরছে যে আমরা তো এখন খুব তাড়াতাড়ি ভুলে যাই. We forget much faster than our parents. Like my mother, even when she was so sick, had a memory which was, her brain was very strong. Her body was, giving up one by one. But her mind, she would remember, I have not had this medicine. She would scold the nurse. If I look at myself, I mean, that's not a good example, but, if I look at myself, I'm so forgetful. I've menopaused at 47. I had an early menopause. And along with a lot of other women, we talk about this, that, one of the things about perimenopause or menopause is we keep forgetting things.
Yeah.
And a sense of brain fatigue, we keep hearing that term a lot now, brain fog, ever since the COVID. It's just like this feeling of ennui, like, kichu ichche korche na, lad jeta banglaয় bole, we just, in a stupor kind of state.
Yeah.
Why is this happening? Why are people, even children, like my sister, she's 16, she's so forgetful. And she's like, no, I'm, because of her exam pressure, she's in 12th, itna project, ye wo. Is it the times that we live in which is, impacting our, brain wiring?
Yeah, I would like to say that it is not a memory loss.
Right.
So there is a difference, and people often mix those
Mix.
things.
Yes, I'm sure.
Uh,
Hmm.
and like you talked about 16 years old girl.
Yeah.
So this is not the case.
Okay.
Attention deficit is one term,
Right.
and memory loss or memory impairment is a different thing.
Okay.
So
Okay.
memory impairment is forgetting few things initially. Memory loss is complete loss of memory. That is called as amnesia. Attention deficit is different. You
No
are not
focus.
concentrating on your work. People are hyperactive. They cannot focus on one thing.
Right.
So in a 16 years old child, there is no condition which can lead to the memory loss, or of your 45 50 years age group as well. There is an training of the mind. We should be focusing on one task at a time. If you are not doing that, and simultaneously you are doing something and
Juggling so
thinking
many
about,
balls. Yeah.
you will forget.
Yeah.
You will perceive as you are forgetting, but thing is different. You are not concentrating. It is called as attention deficit. So both are different.
So this whole, এই যে আমরা খালি জ্ঞান দিই না, you should be able to multitask. I hear a lot of women say this about men, that women multitask much better than men. I think the whole concept of multitasking is a big sham, because I don't think we were meant to do hundreds of different activities at the same time. And definitely for our children, I think they're overworked. They, as you said, they don't play enough sport.
Yeah, right.
They are not out in the open enough. My sister used to go for a swim. She stopped that now because she has no time. She's just running from one tutor to another and doing one project, another project. Her constantly on the phone.
Yeah.
Their school WhatsApp group, buzzing all the time. So that your mind, I think, is fatigued because of that, right?
2 years old children,
Right.
they are constantly seeing
The phone.
scrolling the mobile.
Yes.
They are scrolling on their
They
own.
don't eat without the phone.
Yeah,
I've
of
seen
course.
children
it is
like
very
that.
common problem.
Yeah, कि वीडियो नहीं देखा, YouTube पे nursery rhymes का वीडियो नहीं देखा, तो then the food
They
will
will
not
not
go
eat.
down. Yeah, and working parents, so they just give the, say if there's a help at home, they just give a tab to the help कि भाई चला दो, the child will eat.
Yeah.
So that I think is also, is it
Gadgets are
impacting?
affecting our this
Yes,
thing, neuronal setup,
Right.
and from a very early age we are indulged in the activity of scrolling and all. So it will be definitely the changes of the brain will be becoming earlier age. Degenerative changes.
Right.
We are not exposed to the outdoor activities, exercise, and so many things.
Right.
Just stuck in a chair, seeing the
Sedentary.
phone, sedentary lifestyle. So there is an body mind connection. Is that if you are exercising, it can heal your mind as well. If you are not
Absolutely.
exercising, you will not get that dopamine
Yeah.
all the time.
Right.
You will feel stuck in your some scenario. So you need to exercise first of all.
Right.
I think so.
Right. Well, take that as, the gospel truth coming from the expert. Now, going on to slightly, scarier topics for a layman like me, brain tumors.
Yeah.
And trauma of the brain. We've recently seen our state take very active steps. For instance, in my sister's school, they are having a lot of initiatives about drunken driving, drive safe, be like there's a certain speed limit you must adhere to. Of course, here it's not like, foreign countries, as you know, where, you immediately get a parking ticket, like a speed breaking ticket, right? And here it's not that
It's
effective.
not only that. Suppose some person is walking in front of a car.
Yeah.
They will stop.
They will stop. Yeah.
They will let you cross.
Absolutely.
Until unless you who are not there, they will not.
Yeah.
So it is not.
It is not here. Yeah, everything here is at a breakneck speed. Matlab, it's like we are running against time. Coming to brain tumors, one of the things that a lot of people complain about nowadays is migraine.
Yeah.
It's becoming more and more common, and headaches. I actually had very bad COVID. I was in hospital for a month, And one of my after effects, I think, of all the steroids and everything, I could be wrong, but I assume that I developed terrible migraine, something which I never had. I would only have a headache before my period, which was I surmassed as being a hormonal thing.
Yeah.
A lot of women get that, but migraine seems to have become very common. Sometimes that's also, correct me if I'm wrong, sir, but the first telltale sign of tumors, that excruciating
So
pain,
the migraine
blurriness.
and tumors are entirely different
Okay,
topics.
okay.
And migraine, as we discussed about the stroke and others,
Hmm.
vascular change.
Okay.
So migraine headache is a vascular headache.
Hmm.
Blood vessels in our brain dilate, much more blood is flowing,
Hmm. Hmm.
brain is being feeling pressure and
Too much
congested.
pressure.
So if you want to diagnose the migraine, there are some very obvious signs and symptoms. It is one-sided usually,
Hmm.
either right side or left side,
Hmm.
and there will be throbbing type of headache.
Throbbing, yeah.
In Bangla, they can say that dop dop korche.
Ak kopali dop
Yes,
dop
yes, yes.
korche, correct.
They are scared to be out in the light.
Yeah, it hurts them.
Photophobia, that is called as, and tears from the eyes when they are exposed to, feeling of nauseating feeling, sometimes
Vomiting.
and it gets relieved by sleeping. That is a typical migraine patient. So there are two things. One, there is inconsistent. There will be all every day there is an headache, or sometimes an acute episode, very severe. You cannot tolerate it.
Yeah.
So
I've seen migraine patients, hold 2-3 pillows and
even
light off
after that,
karo.
it will
Yeah,
not
yeah,
get
it
relieved.
doesn't go.
So
Yeah.
it is an episodic thing. It
Yeah.
will last for some time. You get some acute medication, and after that you get an adequate sleep. It will go away. But it is a never-ending thing. There
No
is no
cure.
cure. You have to take
Oh.
care of that thing. Keep and constant medication for your prophylactic medications.
Right.
And when an acute episode happens, you are having intolerable pain. There are medications for that episode
Okay.
as well.
Right.
So tumors are entirely different. Tumors are very bad, and common perception about the brain tumor is that people are not going to live if they have an brain
Yeah,
tumor.
yeah. It's like the end stage.
Yeah. If somebody hears that
Brain tumor.
he or she is diagnosed with a brain tumor,
Yeah.
then they will think, oh, he is gone or she is gone. There is no life. But it is not true. And tumors are of different types. Tumors will enter into the cancerous stage. They are growing very fast inside the brain. They infiltrate the whole of the brain. They cannot be treated. Their life survival is very less, 6 months to 2 years. But there are majority of the tumors which can be treated and can be cured as well.
Okay.
The complete removal of the tumor is possible, and 20 to 30 years tumor free life is also possible.
Right.
So we can do. There are so many recent advances in the management of the tumors.
Okay.
And how will you diagnose the tumor at home? You cannot diagnose it, but you have an suspicion. Somebody is having gradually progressive over a period of time. They are having constant headache, constant nauseating feeling with vomiting, and vomiting which relieves the headache.
Okay.
If you are having severe headache, early morning you get vomiting.
And you feel better.
Yeah. Then it means pressure inside the brain is rising.
Right.
That may be suspicious of any brain tumor.
Okay.
It is not sure that there will be a brain tumor.
Right.
But this is a suspicion.
Yeah.
Or in a period of time, our one side is getting weak. Right or left, anything. We have difficulty. It is similar to the stroke. The only difference is that stroke, as I said, FAST, fast, time. In the strokes, it is sudden onset. In the tumors, it is gradual, over a period of time.
Okay.
Or sometimes convulsions, epilepsy-like features.
Yes.
They get unconscious for a moment and then return to their state. So these are the suspicion for the brain tumors. You can suspect and then contact with your caregiver. Yeah.
Right. But I think this fear of brain tumor also comes from popular culture. If you see Hindi films of the past or even regional language films, brain tumor was always shown as, an end stage disease.
Yeah, yeah.
किसी को हीरो को brain tumor आ गया, the hero's mother having brain tumor, it means that the family needs a lot of money. Sometimes we would see stories where the hero is stealing because of that. He needs to accumulate funds. You said that there has been a lot of advance in the management of brain tumor. I'm coming back, questioning you like a patient or a patient's family. What about the cost? Have advancements also brought down the cost of surgery?
In the benign tumor, we can operate it in the Sasasati scheme
Okay.
here.
Yeah.
I'm talking about the West Bengal only
Absolutely.
right now.
Yes, sir.
So we can do it. If the patient is having benign means it is not an aggressive tumor.
Right.
Why I am talking about that? Because in the benign tumors, the treatment is you remove the tumor and that is all.
That's all.
In the aggressive tumors, you have to remove the tumor, send the biopsy, get the immunohistochemistry, the pathological investigations after the surgery. They are very costly.
Okay.
After that, you may need radiotherapy or you may need chemotherapy. So these things are costing more in addition to the surgery. So in case of the aggressive tumors which have more than stage second, they need an dedicated cancer institute. There must be radiotherapy and chemotherapy
available
in the same under the same roof, with the some help of some scheme which are covering. So Sasasati is covering some radiotherapy as well. I have operated few patients and sent them to the regional institutes and they are covering.
Okay.
But in case of benign tumors, just do the craniotomy and remove the tumor. If patient is doing well, they can be treated under the SS scheme completely without any extra.
Without any extra.
Yes,
I think
yes.
this is very, very helpful information. Coming to brain injuries, sir, we often, I've seen an accident patient right in front of me at the emergency room when I took my mother, a young boy, obviously a bike accident, probably riding without a helmet, perhaps intoxicated. This thing is very common because, people, especially young boys, they love getting a motorbike. It's a sign of their masculinity, unfortunately, in India or anywhere. But, we often see road accidents. We see a lot of articles on, how can you prevent, wear a helmet, wear a seat belt. It can happen in a car as well. Tell us about, any advancements that have come when it comes to brain and spine, because most of these accidents lead to spinal injuries as well as massive, brain hemorrhage or, skull fracture or something like that.
So traumatic brain injury and traumatic spinal injury, these are two entirely different topics.
Right.
And sometimes they are related as well.
Related, yeah.
So suppose that someone is riding the bike, they are wearing helmet, and they fell in such condition that there is no injury to the brain.
Okay.
But there is a movement of spine, whether it is cervical spine, neck, or any other spine.
Yeah.
So there might be injury to the spine despite you are wearing the helmet.
Okay.
If the people have common perception, okay, I am wearing helmet,
तो सब
I
बच
am
गया.
completely
Yeah.
safe.
That's not true.
Not
Yeah,
true.
absolutely.
Your other parts are already
Exposed.
exposed.
Yeah.
And spine injury is way more fearful. It's very scary. Imagine a situation in which you are alive and you cannot feel anything below your face. You can see, you can
hear,
hear, you can talk as well.
Correct.
But you cannot move anything.
Right.
You cannot feel below this. That is called a cervical spine injury.
Right.
So talking first about the traumatic brain injury, this is a vast spectrum, and I did study about the 300 patients, and which I found out that 14 to 35 was the age group in which the people were getting more
prone
traumatic
to
brain
that.
injury.
Right. Right.
They were getting more outside and driving and all,
Yeah.
bike and children.
Correct.
they are playing, getting hit
Hit.
from something,
Yeah, yeah,
or
yeah.
they are falling from the,
Playground, it
yeah, yeah.
happens from that,
So there is
slide
an,
and all that.
yeah,
Yeah.
there are different type of injuries. One is hemorrhage. Our skull is the hard structure. Inside that is an soft brain. And that soft brain is covered by so many layers like an curtain. So there are, when you get an traumatic brain injury, a skull may get injured first of all. Beneath that, those layers can get injured, and lastly the brain can get injured.
Right.
So there are three types, and the severity also according to that.
Varies. Yeah.
If your skull is injured, fracture is there, something, it is operable. Usually it is not life threatening. We can operate it and repair it as well. We can bring back in the normal shape as well with help of some metals and other things.
Correct.
After that, there are different types of hemorrhage which are outside the brain and inside the brain.
Okay.
So the main thing is that these hemorrhages, if they are large, they are pressing the brain to one side. Suppose that somebody has traumatic brain injury on the left side, there is a blood collection on the right side, and it is pressing the opposite side of the brain. So what will happen? Opposite side weakness will be there. Patient may be having convulsions, fits,
Fits, yeah.
and there will be deeply comatose. Consciousness will be very bad. So we evaluate brain injury patients on the basis of the Glasgow Coma Scale, that is called as conscious measurement, measurement of the consciousness.
Right.
And it is classified into the mild head injury, moderate head injury, and severe head injury.
Severe.
So if your score is less than 8, there are 60 to 70% chances of bad result, life threatening. If the score is 9 to 13, that is called as moderate head injury, you will survive.
Okay.
And mild is okay, concussion, so for some period that in memory impairment, mild headache,
But
and all.
you regain your
Yeah.
strength.
We can operate on the patients, remove the hemorrhage, keep them in ICU, neuro ICU.
Yeah.
So for these patients, we need an dedicated neurological setup, neurosurgical setup.
Is that there?
Yeah. There
Okay.
is, it is available, and we can save if they come in time.
Yeah.
In the case of the brain, it is time always.
Time.
Whether it is a stroke, tumor, anything.
Time is of essence.
Early diagnosis and the best result.
Right.
If you are diagnosing the brain tumor also in the early stage, best result.
Right.
So likewise, somebody is on the road and nobody is going there
To help.
Yes.
Yeah. ये तो होता है, it happens.
Legal people will come, they will
Police, this, that.
carry.
In that, time is lost.
Yeah, of course. So golden hour is also there also.
Absolutely.
It is lost
Yeah.
and your result will be bad.
Yeah.
Even the young people are dying because of that.
Right.
And in case of a spinal injury, we have options. And once there is a permanent damage, suppose that is complete paralysis of the body, we can do MRI imaging. We find that spinal cord is completely damaged. In that case, we can go for the rehabilitatory procedures only.
Okay.
We can fix the spine, make the patient sit, and we can go for the long-term rehabilitatory process.
Right.
Which will be comprising of the expert physiotherapists and other caregivers. A patient who cannot rise on her own or his own, we must help. So some caregiver will be coming, they will make the patient sit. Postural care, there should be no pressure sore, bed sore.
Right.
And taking care of the active physiotherapy of the limbs.
Regaining strength.
Yeah,
mobility.
But in case of there is a partial paralysis, we can bring it back. We can operate in time, and there also is an golden time.
Okay.
If the person is coming within 3 to 4 hours of the injury, then we are operating in early stage. We can reverse the partial paralysis.
Right.
And eventually they will be able to walk. So what are the different signs and symptoms of the spinal injury? Patients will be having a history of trauma. there will be no unconsciousness or maybe unconsciousness. If the patient is conscious and still they are not able to move their limbs, that means spinal injury. A patient is coming to you in the emergency room who is unconscious. You cannot assess whether they have a spinal injury or not. But patient who is conscious and still they are not, so
Able
there
to
is a
move.
high suspicion.
Right.
So how will you diagnose which level injury is there? Cervical spine, this neck, where our brain ends, spine starts. So the most important is cervical spine. We have our control of the both upper limbs, upper limbs, hands and legs. The entire body is controlled by the cervical spine. So if there is an injury into the neck or cervical spine, everything will lost below the neck. But if your only legs are not working, upper limbs are working, then there is injury below that. It is way better.
Correct.
You can still use your wheelchair and everything.
Right.
So in that case, we have to do MRI imaging as early as possible, diagnose the condition and treat in the specialized centers. We do have minimal invasive approaches as well. We will operate and you cannot see any scar. Right.
We've come to the end, almost the end of this extremely informative hour with Dr. Gupta. But before I let him go and এত ব্যস্ত এত বড় ডাক্তারকে এতক্ষণের জন্য এরকম পাওয়া, I think it's a great privilege. Thank you again for your time. There's a word that is used a lot today, that is mindfulness. And be it a school, be it a corporate office, be it amongst creative people, we hear about this. How do you train the mind into stillness and acceptance and gratitude? I would like you to tell me, as a doctor who has seen a vast range of, neurological issues, the brain is really the, it's like the headquarter of your body, right? And it's almost like a complex electrical circuit, because there are so many little points. And I've seen enough of Grey's Anatomy to see those brain surgeries where you can actually see an open brain. How much of importance do we need to give to keeping our brain healthy? When it comes to something like diabetes, it's easy for an endocrinologist to say, don't have this, don't have that, do this, do that. But when it comes to the brain, what are the things we can do? Of course, you've mentioned the warning signs, things that we can watch out for. But are there any, for instance, exercises of the brain? How can we practice better sleep? I think every person I talk to today, I go to a gym, tells me about their struggle to sleep. That, either they're addicted to the phone, and we get advice like keep your phone away during sleep. But then if you're a corporate slave, then you're going to check that last email, or that, that urgency culture. Also, I think that, we never hear advice about the brain. It's an organ which is so critical to the functioning of our body, but nobody really tells us the things to do, or the tests we should go for, or the sort of lifestyle changes to make to keep our brain healthy and operative.
So brain is not only responsible for the thinking and other things, it is controlling everything.
Absolutely.
Every part of the body.
Yeah.
If I start right from the face and everything, and your all the intestines, your gut, your stomach, heart, even heart, the rate, respiratory center, the breathing, everything is governed by the brain only. There are different centers in the brain which go give an coordinative signal to the other systems.
Right.
So if your gut is also not healthy, if your liver is not healthy, everything has an connection to the brain as well.
Okay.
So this is an entire full scenario. You have to keep yourself healthy in the as an body, as an whole, not only the brain. But brain is controlling everything.
Right.
The cure or help is around yourself. You have to look, maintain values. Number one, we have to keep our people who are positive
in our lives.
Yeah. we maintain good relationship with them.
Mm.
Often in present era, we are feeling alone.
Mm.
No matter how we show off at our work,
Yes, yes.
whatever
Yeah, yeah,
things
yeah.
we achieve,
Mm.
even if we are on a top of our field, then
Mm.
also we are not getting that positive interaction
Mm.
with our parents, with our siblings, with our friends. We are not getting that.
Right.
Everybody is busy in showing that things,
Yeah.
but they are not sitting together.
Mm.
They are not drinking a coffee together.
Mm.
They are not eating together.
Right.
Neither they are having lunch or dinner, nothing.
Right. Right.
So the first thing is that you have to maintain good vibes around you and practice the gratitude.
Right.
Gratitude is very important.
Mm.
Whatever you are getting, whatever you have achieved, you are not doing it alone.
Mm.
There is contribution of so many people, Almighty as well. So
Right.
you have to recognize that.
Mm.
People forget these things.
Mm.
So number one, you have to maintain interaction with your closed ones in a very positive way, so that
Right.
they can be supportive. You should not feel alone all the
Alone.
time.
Mm.
They will be helping you.
Mm.
Number two is you have to get constant education for your maintaining your body, mind and brain and body as well.
Mm.
How to keep your gut healthy,
Right.
how to keep your physique healthy, exercising, meditation, different types of indigenous
Mm.
methods and Western methods are available.
Right.
People are doing yoga,
Mm.
some meditation,
Mm.
positive sessions. These are the things.
Right.
If you are feeling something, if you are not having sleep and all, you must consult and seek the help.
Mm.
The only problem is that we are not seeking. We are living it on our own and thinking that it will gradually resolve. But it
Yes.
is progressively increasing.
Right. Right.
So if you are not getting sleep, why you are not getting sleep? Because it might be possible that you not ate in anything healthy.
Mm.
It is causing gastroesophageal reflux. You
Mm.
feeling acidity and all.
True.
You are smoking. You don't have fix your time for the sleeping.
Mm.
Go to the bed 10 or 11 maximum. You eat the dinner at 12 and you will be going 2 a.m. in the
Yeah,
night for
yeah,
so
yeah.
obviously you will be
System
waking
is
up
all
later.
over the place. Yeah.
So making good habit and schedules is necessary, but you cannot do all these things on your own. You need support. Everybody needs support,
Right.
and you must not be feeling ashamed in seeking that support from your loved ones. I think so.
Mm.
So you must maintain an adequate chart, routine of your diet, what things you are taking care of. And if you are having some symptoms, then you must find out why it is
Why
happening.
it's happening.
You might be suffering from the hypertension
Mm.
and you are ignoring that. Maybe I am having dizziness, I am tired. This may be due to some cardiovascular problem, and it is not uncommon at our age. It is happening. Our heart is not functioning in that way. It is not giving blood to the our organs in that way. We are feeling tired. We are not getting enough energy. We are not eating properly. So we must diagnose and do not ignore.
Right.
Stop the bad habits. At least try to reduce them.
Curb it. Yeah.
You have a smoking habit, I have a smoking habit, maybe. So we have to try to get rid of that.
Right.
So in this case, I would like to suggest few steps. That first, identify your exact problem. For what you are suffering. If you are having lack of sleep, then write it down. This is my issue. I am having lack of sleep.
Right.
And find out 4 best possible solutions for that. Sort out one of that and take an action and seek help of others.
Right.
So mind and body, they are connected, interrelated. I mean, it is an complex connection. Not only inside the brain. Brain is related to the spine, brain is related to the heart, and brain is related to the gut as well. Out of the way, people are feeling commonly increasing problem in the sexual dysfunction.
Right. Right.
And they will never share it. Diabetic patients, they are feeling erectile dysfunction and all.
Right.
Loss of libido, loss of desire, and they will never share it.
Yeah.
but
ये
they
तो
don't
this is
know
very
that it
taboo.
is entirely related to the neuronal system
Okay.
and mind as well. So this is the topic which we do not talk about, but inside their lives it is affecting to the very bad extent.
Exactly, exactly. When you say that it's connected to the neuron level, can you sort of elucidate?
Yeah, there are centers. It neuronal level means neurons are in the brain and
Hmm.
spinal cord both.
Hmm.
So there are some systems, autonomic nervous system,
Hmm.
that is sending impulse, and
Signs.
then yeah,
Hmm.
that is sending impulse when you are thinking of something and you are not getting arousal or erection. That
Right.
means something is wrong at the level of the neuronal or
Okay.
spinal cord.
Hmm.
It might send some impulses, but they are not executing at the ground level.
Hmm. Hmm.
So blood vessels are not being dilated. There is no erection. There is no desire to do anything.
Right.
This is a topic which we usually don't talk
I
about,
know that. Yeah, yeah,
but
yeah.
it is extremely important.
And also extremely common.
Yes,
Both. I'm sure you're getting a lot of
I am
patients.
seeing lot of patients. They come to me and talk about it,
Right.
but they do not talk about it in the early stage.
Okay.
They are suffering, and when they find no way, then they are
Hmm.
coming.
They're coming to you. What could be the cure for something like this? Medication?
Medications are there, but we need to diagnose where is the problem.
Okay.
There are sometimes non-diabetic patients as well.
Hmm.
Sometimes there are psychological problems
Issues.
also,
Yeah, yeah.
but it is not entirely psychological. There
Right.
might be a damage at the level of the neurons in the brain and
Hmm.
spine as well,
Right.
who
Right.
are sending impulse to the genitourinary system or sexual system, but it is not working at
It's
all.
not working at all.
So you have to do an extensive workup, take the history and talk to the patient, and then we can find the solution as well.
Right. I think a doctor who discusses things so openly with his patient, I think it would be an absolute privilege and pleasure to go to such a doctor. আমি একটা আমার ব্যাড হ্যাবিট আছে, it might make you laugh, sir. Whenever I go to a doctor, I always ask them that আপনারা ফোন তোলেন তো
Hmm.
আর হোয়াটসঅ্যাপ দেখেন তো, বিকজ আমাদের এখানে doctors, I think being inaccessible is considered that, oh, they are such big doctors, they're so famous, that it takes 6 months to get through to a doctor. So I'm sure a lot of people watching jara benefited hocchen from this very, very enlightening discussion on a range of neurological issues, would want to know how they can access you. Are you accessible? Of course, we would be putting out numbers of HP Ghosh Hospital as due diligence, but where can we, if somebody wants to consult with you, how may they reach you?
Yeah, as far as HP Ghosh is concerned, there is helpline and other things are there already. But my team is there,
Okay.
and they can provide the number. They are all
Right.
the time 24 hours available.
Okay, okay. So this is a doctor who will speak openly to you, which I said is such a pleasure. And also his team at HP Ghosh Hospital will ensure that you are well taken care of and guided towards the right line of treatment. Thank you, sir, for sharing such important nuggets of information. I always believe that the mind-body connection, as you yourself said, is complex, but it's sacred.
Yeah.
And in the times that we live in, which is so competitive, so superficial, so fast, so aggressive, so in your face, we have to treat our bodies like a temple.
Yeah.
I go to the gym every day. Today, I miss my gym because of the shoot, but I will, compensate by working out on the weekend. Usually, I don't, because for me, it's a matter of my mental well-being.
Sure.
More than, being thin, which is never my objective. I think make physical workout, as sir said, interacting with positive people, also curbing negative influences from your life. If you're not getting good vibes from a particular organization, a particular set of friends, have boundaries. You don't need to entertain, people who
Talk to the right people.
Yeah,
and
talk to the right people. Absolutely. And as sir said, which I think I have realized having lost my parents, is that you have to also not neglect signs of, a problem that your body is, it's like a bulb অনেক ফ্লিকার করবে, ফাইনালি ওটা বন্ধ হয়ে যাবার আগে। সো your body is giving you signs. Listen to your body. Go to the doctor. Do not be afraid. Do not feel ashamed, if you're young and you're having these symptoms. And there is no taboo really. We have to abolish these taboos. There are good doctors who've made Kolkata their home, state of the art hospitals like HP Ghosh doing cutting edge surgeries in the field of neuroscience. I wish you all the best, sir.
Thank you.
And I hope listening to this, we get a lot of.
I would like to send a message.
Yes, please.
Because there is a myth and in the mind of the people, neurosurgery is very scary.
It is.
And it's not like that.
Yes.
We can cure people of the spinal disorders, of the brain tumors. Everything can be cured. There is a lot of cure coming right away. So people must be knowing that there is a cure. It is not any scary thing. And we would like to give the results.
Right.
We are giving it already.
Right.
I have performed more than 10,000 of surgeries till date.
Wow.
And in brain tumors, I have excellent outcome, 99%.
Right. Right.
So people should not be afraid of undergoing evaluation first from the neurosurgical point of view.
Absolutely. And like I said, a pleasant, cheerful, a handsome doctor is always good on our eyes. It's good for our mental health. Somebody who's so open, who will address your concerns, who will put your mind at rest, that don't worry, there is light at the end of the tunnel, is an absolute privilege. Thank you so much, sir, for being on the show. আমাদের শোটা আজকে একটু অন্যরকম আপনাদের লাগবে, কিন্তু মাঝে মাঝে একটু দরকারি কথা শোনা এবং বলা দুটোই খুব জরুরি। এই এপিসোডটা যদি আপনাদের ভালো লেগে থাকে, প্লিজ ডু লাইক, শেয়ার অ্যান্ড সাবস্ক্রাইব। বেল আইকনটা প্রেস করুন। ডোন্ট বি লেজি। নেক্সট উইক আশা করি এরকমই আর একটা ইন্টারেস্টিং এবং আই ওপেনিং এপিসোড নিয়ে আপনাদের সামনে আসতে পারবো। কিপ টিউন, স্টে টিউন, স্টে হেলদি, গিভ ইয়োর মাইন্ড আ রেস্ট. Give your body a rest also. Learn to pause, learn to reset, learn to practice gratitude. These are all things which can make your lifestyle, make your life journey a little better. And of course, when you have a problem, go to your medical practitioner, seek help. On that note, আবার next week দেখা হবে। সুস্থ থাকবেন, ভালো থাকবেন। নমস্কার। Thank you.